I'm really pleased to introduce to you Dr. Carrera, whose name I always mispronounce, and she's extremely gracious about that. Dr. Carrera has been at MSU now for 2 years. She has a substantial and important research program and published research record in the area of healthcare and healthcare-related issues. And I'm really appreciative of her being willing to speak with you all today. Some of you may have had her in class and know how effective and insightful she is. If you haven't, you're about to find out. So, Dr. Carrera.
Thank you. All right. So, is this effective? Okay, great. All right, thank you, Vince, for that lovely introduction, and thanks for inviting me to be here today. So some of you might have taken a health economics class that I teach here. Has anyone taken health economics? Okay, a few familiar faces, though it's hard to see with the masks on. So as you guys will know, I spend a few lectures of that course talking about issues that we'll touch on today. We learn about the U.S. healthcare system, what makes it so different from others, more expensive than others in many ways. We study topics like adverse selection that I'll touch on. What were the motivations for the Affordable Care Act, also known as Obamacare, that features so prominently in pretty much every presidential election we've had in your memory. So we'll get sort of a Cliff Notes version of some of those issues today, as well as, of course, the COVID pandemic. So healthcare is always one of the top issues when you ask voters that they care about. In recent elections, anywhere from 70 to 80% have ranked it as very important to their decisions. Why do people care so much about this? Well, they care about having health insurance, and they care about the rising cost of healthcare eating up a bigger share of their take-home pay every year. The cost of prescription drugs is also a hot topic in the past decade or so. So that's always been a top hot button issue, and on top of that, we're living in 2020, where the defining feature of this year is the global crisis of the coronavirus and the severe economic repercussions it's having, not just causing a recession in the U.S., but across the world. So of course, these two issues are top of mind. The U.S. is actually leading the world in deaths. Part of that is due to being a large country, but we're only 4% of the world population and have now 20% of the deaths. So that's not great. So here's a recent poll of the 2020 election. What do you think is very important to your vote? Not surprising that the economy is coming first, given that we're in a crisis. But then second, healthcare. Fourth, the coronavirus outbreak. So these are really important topics to the electorate as a whole, and hopefully you'll learn a little bit more about the positions of the two candidates today. So I'm going to start this talk by giving you a brief history of Obamacare, because that is central to the platform of Joe Biden, who's running on a platform to protect and expand on Obamacare. Trump ran in 2016 on a platform of repealing Obamacare. We'll talk about those efforts in a little while. In terms of 2020, he hasn't given too many details of what his new health care policy is, other than saying that there will be a beautiful plan coming to replace Obamacare in a few weeks. So we're still waiting to see what that is. Both candidates have talked also about proposals to lower prescription drug costs. So I'll spend the first section talking about Affordable Care Act, expanding insurance, and how that has worked. Then I'll spend a little bit of time on the issue of prescription drug costs, although I really won't be able to do full justice to that here. That could be an entire lecture on its own. And then I will end by talking a bit about the coronavirus pandemic. Has the U.S. really done so badly? And is that Trump's fault or not? Obviously, what the Democrats are trying to push is the idea that Trump has botched this response and that the pain we're suffering economically and in terms of health is his fault. So we'll look at that question in the last third or so of this talk. Okay, but first, let me give you a little bit of overview on the Affordable Care Act, which passed when you were all probably in grade school. So you might not, you've probably heard it in passing a lot, but might not know what it was really about. So this was the biggest healthcare reform to pass in this country since the start of Medicare and Medicaid in the mid-60s. And the major motivating problem was the high number of uninsured in America. So the U.S. is one of very few advanced developed countries that doesn't have universal insurance coverage. Some countries have a national health care plan. Others have a mostly private plan, but with some public options. But most countries have almost total or complete coverage. And in the U.S., there was as high as 15 to 17% uninsured at the time that this law was being put together and debated and written. So that was the main goal, to increase healthcare insurance in the U.S. Why is uninsurance bad? Well, then if you get sick and need help, you might delay getting care, you might let a problem get bad, it gets more expensive, leads to bankruptcies, has obvious costs for worker productivity, quality of life, and so forth. So the idea was, we're an advanced economy and strong society, we should be able to insure more of our population. Okay, so the U.S. is a bit unique in its healthcare system, which is highly dependent on employers, on getting insurance through employers. If you're wondering why, the history is that it all goes back to, post-World War II. There were restrictions on, the government passed law saying that firms couldn't raise their salaries because they didn't want efforts taken away from war efforts. So instead, it was kind of a loophole that companies that wanted to lure workers started offering healthcare benefits, health insurance, which turned out to be not considered wage compensation and wasn't taxed. So because of that loophole, it launched this system where more than half of Americans get insurance through their employer. Another third or so of Americans get their health insurance through a public system, such as Medicare, which is a public plan just for those above age 65. So anyone who turns 65 and is an American citizen immediately gets all this paperwork asking them to enroll and choose in what sort of Medicare plan they want. Medicaid is another public plan that's managed by states, and that's targeting the very low income. So vulnerable populations that, Medicaid was designed to kind of help them out. The VA is another public system designed for veterans. So about a third are getting it publicly, more than half are getting it through their employer, but the other 15% or so were falling through the cracks. This is 50 to 60 million people in 2012. And why are they falling through the cracks? About 2/3 of them are what's considered working poor. So they have jobs, they might be working 2 part-time jobs to make ends meet, but none of their jobs is the type that will offer them a health insurance plan, either because they're not full-time or because they're small companies or because they're working for themselves, working from home on a farm. And the question is, what do we do with those people? If they're not poor enough to get Medicaid, but they don't get it through their employer, what else is out there? Well, what else was out there? Technically, insurers could sell policies in what's called the non-group market. So individual policies for just any random person who wants to get health insurance. But this market had a lot of problems. It was the broken market that the Affordable Care Act set out to fix. So to understand why it was broken, I'm now going to go into the most hardcore economic theory that you're going to get in today's lecture, the key concept of adverse selection. How many of you have learned about adverse selection in your other econ classes? Okay, a few. So adverse selection is a problem that arises when there's hidden information or asymmetric information in a market. So either the buyers or the sellers know something that the other party doesn't. In the case of health insurance, the issue is that individuals know a lot more about their health risks, how likely they are to need a lot of health care in the next year than the insurance company knows. I might know that there's a history of diabetes in my family and I'm getting close to the age or health status where I might get diabetes. I might engage in very risky outdoor activities that mean that I break a bone every few years. I might know that and really want to get insurance coverage because of that, but the insurer can't see it by looking at me. What does the insurer observe? They just see the average. So they just know what average healthcare spending is across a population, and imagine they just have to set their price based on that. So they pick the average price that they're going to pay out each year and say, well, that's what you have to pay to get this policy because on average, that's what we will then pay for you. Who's more likely to buy that policy? Yeah, exactly. Someone who's above average in their own private knowledge of their healthcare risks. So if everyone buys it who thinks they're above that average and they're going to get a good deal through this policy, nobody buys it who knows they're low risk because it sounds expensive to them, what's going to happen? The insurer is going to lose money this year. They're going to raise their prices next year after observing their mistake, and this can happen year after year, leading to what we call an unraveling of the market or a death spiral. So that's a problem in markets, in any markets with hidden information. It's not particularly problematic when you've got near complete coverage within a large population, because if everyone's buying it, then the average cost will be equal to the average cost among the people who buy in. So this is actually one of the benefits, one of the nice features of the employer-sponsored system is that within a large employer, if that's the main way people get their insurance, they'll buy the plan their company offers them. Almost everyone's buying it, so you don't have so much adverse selection. But it's a huge problem in that individual market because among the people who aren't getting it through their jobs, some of them might be young people who just finished college and are living at home and are pretty healthy, hardly ever go to the doctors. They're not going to want to pay, thousands of dollars to be covered by a health insurance plan. But someone else who knows they're sick and knows they need a lot of health care is going to want to buy it. So that individual market had been unraveling for over a long period of time, and insurers were trying to protect themselves by choosing who to offer coverage to. So before the ACA, this market wasn't very highly regulated in the sense that insurers could just say, no thanks, you have to fill out these detailed health forms, we're going to look into your records. If you've had any visits to a psychiatrist and they say you had depression, we're not going to cover you. If you have sleep apnea, we're not going to cover you. If you have any sort of pre-existing conditions on this long list, they would say, no, thank you, we just want to cover the very healthy. So obviously that's awful from an equity perspective, right? It's not someone's fault if they've had these health problems, and we don't want those people to go without insurance for the rest of their lives. But you can also understand it from the insurer's perspective. If people choose what to buy, then the only people who buy it are going to be the ones who are costly. So that was the problem going on in this market. And here's how the Obamacare reform tried to correct it. they put in place a three-pronged approach. And Jonathan Gruber, an economist at MIT, was one of the main architects of this plan. And the way he explains it is as a three-legged stool that needs these three prongs to work. If you remove one of them, the stool falls over. Okay, so the first part was, the part that's very popular that people loved was that guaranteed issue, right? No one's going to be excluded. All these horror stories of people being denied coverage, those horror stories will end because in this marketplace, you can't exclude someone or even price discriminate based on their pre-existing conditions. But that's going to be really bad for the insurers, right? If we let people buy in when they want, then they're going to take advantage of this and wait until they have a problem and then buy coverage. So that goes hand in hand with an individual mandate, which you've probably heard a lot about, a controversial topic, but the reason it's there is because these go hand in hand. If you don't exclude everyone, but we also want to get those healthy people to buy in, then you won't have the adverse selection problem. You'll have everyone buying into insurance coverage. And of course, legally, this was murky. How do we force people to buy this? They ended up making it either you buy it or you pay a hefty penalty when you're filing taxes. But you still need one more thing, right? Because people still are really not going to like the idea of this individual mandate being forced to buy something. What if they can't afford it? So the last piece was to make it affordable. They put in place subsidies that are scaled with your income to make sure that no one is having to pay too much for this coverage. For example, the subsidies went up to 400% of the federal poverty line. So that means, there's a federal poverty line, and then multiply that times 4 to include the lower middle class, working middle class as well. They won't have to pay more than 9% of annual income for one of these plans. And if you're closer to the poverty line, the poorer you get, the smaller that percentage gets. So subsidies that depended on your income that would make these plans affordable to you. That was the idea. That's the three-pronged approach. And Gruber actually put out this book with cartoons explaining the logic of the Affordable Care Act, and has this picture saying, we know no one likes being forced to do things, but think of the mandate as the spinach. You have to eat it if you want to earn the right to, if you want to earn your chocolate cake. So the dessert is having a working non-group insurance market. What we need to get there is the spinach. Okay, so did it work? What happened? Well, it did reduce the uninsurance rate by around 40%. So that was, good. That was what it had hoped to do. The statewide exchanges helped build towards this, although the take-up was not quite as high as predicted. More people ended up just opting out and choosing to pay the tax penalty instead of following the individual mandate and signing up. Medicaid expansion was another huge piece that I haven't talked about yet, but Obamacare also included asking states to increase who qualifies for Medicaid in their states up to 133% of the federal poverty line. Before that, it varied state by state, but the federal requirement was only up to 67% of the federal poverty line. So even someone at the poverty line wouldn't necessarily qualify for Medicaid in every state. This became controversial. Governors in many states, particularly Republican governors, didn't want to do this, and so there was a Supreme Court battle. The Supreme Court decided the state doesn't have to accept this change to their Medicaid if they don't want to, and so state by state they made the decision. As of now, about 34 states expanded Medicaid, and the studies of what that has accomplished are generally positive, showing that this expanded insurance does improve health and improve other benefits like mental health and reduce bankruptcies and so forth. But about 16 states still have chosen not to do that. And then the last way that the Affordable Care Act reduced uninsurance rate, which I mentioned in part because it's potentially relevant for all of you, is it said that all insurance plans in their dependent coverage should include children up to age 26. So what was happening frequently was, in college, you have some sort of health plan through your college, but when you finish college, maybe you don't get a job right away and you're uninsured for some time. Now the law says that you have to be eligible to be included as a dependent on your parents' plan. Okay, so as I'm sure you all know, this Obamacare has always been a controversial issue. The Republican Party has been completely opposed to it and fought many elections campaigning on the issue of getting rid of Obamacare. So what are the problems? What are the concerns? So it's a mix. So some of it is ideological opposition to issues like the individual mandate, although that's a little bit ironic because when it first came up as an idea, it was an idea first championed by Mitt Romney in Massachusetts. The Massachusetts plan was the precursor to this national plan. So originally it was more of a conservative idea. The liberal idea originally was a public option plan, covering everyone through a national health care plan, and this idea of private insurers but an individual mandate first came from conservatives, but then they became opposed to it. And they also have some other concerns about how stable these exchanges will be given all the restrictions. Will we see spiraling healthcare costs within the exchanges? Or if they can't raise prices in the exchanges, maybe instead we'll see insurers raise the price of all the other plans that people had and liked before then. So there was a lot of opposition to the idea of making this big change, which might just end up hurting either the quality or the costs of people's employer-sponsored plans that were okay before. So the Republican-led House of Representatives voted 54 times to repeal the Affordable Care Act when Obama was still president, so obviously those votes didn't really go anywhere. Ultimately, there was a bigger push once Trump took office and the Republican Party controlled the Senate, the House, and the presidency. So they made some real efforts to come up with a plan that was better, or just, there was all this debate about whether they should repeal it without a plan to replace it. Do they need a plan to replace it? Obamacare polled poorly, but then the repeal also, people didn't love the idea of repealing it without coming up with some plan for how to cover these people who now get insurance through an exchange. What are you going to do? Just take away their coverage? The protections for pre-existing conditions were extremely popular, so this was also a sticking point of how to come up with a replacement plan that did or didn't include these protections. Ultimately, the plan that they voted on that almost passed did not protect pre-existing conditions, and it failed by one vote. John McCain did his famous thumbs down, and that's when this effort kind of died for the time being. Okay, so Trump has followed through in trying to dismantle the law as much as possible. So even though they didn't succeed in actually repealing it, he has been able to do some important changes. The most important change was to essentially end the individual mandate. The way this was passed was through a tax reform. They were able to say, well, since the penalty for the mandate is through the tax system, we're going to change the tax law so that it's a $0 penalty. So it's not actually removing the mandate, but it's removing any punishment for not following the mandate. So that has been a big topic of interest in the past couple of years. In my health class, we've always been anxiously following the numbers to see what's going to happen. I told you it's a three-legged stool. What happens when you take away enforcement of the mandate? Will these markets collapse? And surprisingly, they haven't really collapsed. They've stayed pretty stable. A big reason for that is that, well, one reason is that some people don't know about it. The polls show that, yes, many people, don't understand the intricacies, that now there's no penalty for not getting the insurance. And among those that did know, about a quarter now chose not to buy it anymore. So it did increase uninsurance rates again from the trough that was reached in 2016 or 2017, but it hasn't been it hasn't completely taken away the gains of Obamacare. A few other measures have been taken, removing some of the taxes that were put in place through Obamacare that hadn't taken effect yet. There's been Supreme Court battles trying to strike down various parts of the law. So there's still an effort to dismantle it as much as possible. Now, Joe Biden, of course, comes from the opposite direction and says, I want to protect Obamacare, I want to build on it. Of course, he was Obama's vice president, so he was there when the law was put into place, called it a big deal, in other words. And his plan centers around adding a public option. A public option he talks about as basically allowing people to buy into a plan similar to Medicare if they want to. The idea would be that this would be kind of a bare bones plan. People could always pay more for a better, fancier insurance plan that covers more, but that we could at least give people some insurance if they buy into this inexpensive public plan. This would also help circumvent the states that have chosen not to expand Medicaid by saying, in those states we'll have a public plan that mimics the same benefits as Medicaid for people who would have qualified for Medicaid in other states. And Biden's, proposal says that this would increase insured rate up to 97%. He also proposes expanding subsidies to make the insurance more affordable. As of now, the subsidies only go up to 400% of the federal poverty line, which means people just above that, they don't get any subsidies, and so for them, the plans still seem quite expensive. So he plans to expand subsidies across the population so that no family would have to pay more than 8.5% of their income for coverage. And how to fund this, of course, expanding subsidies cost money. Creating a public plan would cost money, and his main measures for how to fund this would be to close a loophole that allows capital gains not to be taxed right now, and to roll back the 2018 tax cuts on the very wealthy. So this is what I got out of the campaign website, which has a lot of information on and pretty detailed proposals. So now we'll turn to prescription drug spending. Okay, so as you probably know, the U.S. leads the world in prescription drug spending. That's our line. This is expenses per capita per year, and we've always been near the top of the pack, but really in the past 30 years have been way above the rest of the world. Drug pricing is a tricky issue. We give patent rights to innovators who get a drug first to market. So the idea is giving them the ability to price freely, lets them, and requiring that nobody else can sell that drug for a number of years will give them incentive to innovate. But the trade-off is then affordability. So the U.S. doesn't have any price restrictions on what sellers can charge, whereas most other countries down here do have price restrictions. So there's this notion that the U.S. is, paying the big bucks on these drugs to give drug companies incentives to innovate, and really everyone's reaping the gains from that innovation, and we're the only ones paying for it. That's one of the ways this issue is phrased. but it's a hot topic because even, I mean, both sides of the aisle, this is sort of one of the few things they agreed on in the 2016 election, and still is that we should take some measures to make prescription drugs more affordable. So both sides of the aisle talk about that. In terms of what has been accomplished by the Trump administration, it's been some executive order actions, some related to importing drugs from Canada, although it's hard to know what the real impact has been of these policies. I tried to read as much analysis as I could, but there's kind of mixed reviews about what the actual impact is. But clearly he's trying to do something to say we're acting on this issue, but it's a challenging one to act on because you've got a lot of different views among the industries that are important to this issue, lobbying against any sort of reform and so forth. So Biden also talks about lowering prescription drug prices. He has a few concrete proposals, such as repealing the law that prevents Medicare from negotiating with drug companies. Right now, Medicare is allowed to negotiate with, say, providers and hospitals and set prices there, but Medicare is legally prevented from negotiating for lower prices with drug companies. So that, he views as a common sense way to at least let Medicare use its buying power for its large population to get better prices. He also proposes for new drugs, instead of allowing total freedom of monopoly pricing power, using something called external reference pricing, where you look at what the prices are of these drugs in other countries, and you would, for example, say you can't charge us in the U.S. a price that's so much higher than what you're charging other countries. Other proposals to end surprise billing, fight market concentration, improve access to contraception, abortion, mental health care. So I'm not going to talk much about all these issues because I want to get to the last big topic here, which is coronavirus pandemic. Has the U.S. really done so badly? And if so, can we blame Trump, or would that be unfair? So yeah, I already mentioned the statistic, 20% of the deaths, certainly not a good sort of race to be winning right now. And what's troubling is that this is just confirmed deaths. If we look at what epidemiologists measure as excess deaths, then it's even higher. Then we've already passed the 200,000 threshold. And what that means is, if we look at trends in how many deaths there are in each month of the year in recent years, usually we're pretty close to this trend line. And this year, this is what it looks like. So this red mass is the official confirmed deaths linked to COVID-19. The blue mass is the excess between what we expect to happen in a normal year and what's happening this year. So that's sort of evidence that, we already know not all cases are diagnosed or reported, especially in areas with hot spots like New York City. When it was worse there, they had ambulances just going to people's homes and finding people already dead. Well, they don't get tested, they don't get counted as an official case, but this shows us that they're clearly also related to the pandemic and adding to that total death count. I'm going to give you the answer. There's no sugarcoating it. Is Trump responsible? In large part, yes. It has been a botched response. I don't think it's possible to really argue against that. So here's just some of the mistakes. Dissolving the White House's pandemic preparedness team that the Obama administration had put in place after the Ebola outbreak, specifically to coordinate government response so that it could be as rapid and effective as possible when the next pandemic rolled around. So that team wasn't in place anymore. The leader had basically been pushed out, downplaying the threat, calling it a hoax, failing to coordinate any sort of effective national strategy. Other countries that were more effective about this were investing hugely in getting tests, testing as much as possible, tracing and isolating cases. And that was it was frustrating, at least to me, following this in March and April, to see that we were shutting down states and asking people to stay home, but instead of using that time effectively to say, we're using this time to develop these tests and roll them out and make sure we're in a position to open back up safely, that never happened. And of course, politicizing common sense measures, scientifically proven strategies such as wearing masks, contradicting the CDC. I think it's not too controversial to say that none of this has helped, and it's angering because it's life and death, right? So many people have died because of this. So this is a graph of new cases per day, comparing the U.S. to some other countries. What you'll see is that, this was March and April when we we closed campus, said you're not coming back after spring break, shut down, quarantined, and then, in most of these other countries, they waited till that was all the way back down to be sure it wouldn't surge back up again. And in this country, instead, this is what it looked like. So in March and in the end of April, some states had shut down, some states never shut down. Trump was actually pushing for reopening as quickly as possible. The reason it looks like this is because the first surge areas were like New York, Boston, Detroit. Those were actually coming back down, but everywhere else in the country it was still rising. And so not the best time to just say let's reopen everything without having an actual strategy for testing and tracing. A quote by David Frum that I agree with is, the first coronavirus spike in late April can be blamed on the president's negligence. So yes, he could have acted better, he could have done it, but it wasn't, intentional. But the second spike in June is his own doing, meaning he bears more responsibility for allowing this to come into this terrible second wave that we've seen this summer. Okay, so of course I don't want to make it sound like Trump hasn't done anything correctly or anything positive to fight this pandemic. He did take some actions like travel bans entering the U.S., although those were kind of too little and too late. They were, targeting China, for example, when Europe had already become the next hotspot, and Europe wasn't included in the travel bans at the beginning the way China was. And even when it was already obviously within the U.S., there were no measures taken to try to limit travel within the U.S. Other countries did take much more proactive measures limiting travel within regions, asking people to stay home on a national basis. When you have a contagious disease, the key economic issue there is externalities. Someone might not view it as particularly risky to them to get this disease, and for them it's worth the benefit to take a spring break trip to Miami when it's spring break, but the costs are higher when you impose a risk on others just by traveling, that you might have the disease, you might be asymptomatic. So when there's externalities, that really calls for measures taken to combat those externalities. And the best case scenario, I think, would have been, nationally coordinated measures, so the governors of different states didn't have to be all playing a guessing game trying to figure out what to do on their own. And not only that, but if one state might be handling it very well, but then if the state next door is traveling freely, that limits the effectiveness overall. So a coordinated national strategy could have made a huge difference. There were relief bills passed by Congress. I would also say that those are too little compared to what other countries are doing, because what you have is there's an immense pressure. People want to go back to work because they need to get paid. But at the same time, maybe it would be better for the purposes of stemming this outbreak to to say, well, let's just keep restaurants closed and don't worry, restaurant owners, we will pay you, right? We will give you the help you need to weather this time, but let's keep the restaurants and bars closed, for example. That's just one example of how the government could be more proactive in saying, these are the things we need to do to stay safe, and this is how we're going to use stimulus spending to avoid damaging people in the process. Relaxing rules to allow greater use of telehealth, that's been helpful, allowing people to see the doctor from the computer or from the phone, obviously what you want when hospitals can be filled with people with a contagious disease. Okay, what's the Biden plan for combating the pandemic? He says he would like to have free and widely available rapid testing, free preventive care and treatment, an economic response that's much more proactive, starting with emergency paid leave for all who are affected, more transparent reporting and CDC surveillance of cases, and using the Department of Defense apparatus to basically have more teams on guard, more personnel who can increase surge capacity where it's needed, more efforts to increase production of personal protective equipment, which has been another challenge. So, okay. Oh yeah, I thought I had another slide here, but maybe it's not where I thought it was. Yeah, so another challenge was, I think Trump has really failed to be a leader in the sense of giving the governors some sort of guidance on what to do. His quotes were more like telling the governors, all right, you're on your own, you call your own shots, but that's problematic when we're in an interconnected country. The actions of one affect another, and we really should be fighting this with strong leadership at the helm. Okay, so to summarize the positions on healthcare that I got from the two campaign websites, protect and build on the ACA is number one, but Biden also has a number of additional proposals. And for Trump, efforts during the first term to dismantle Obamacare, so not as successful as he had hoped, but he has dismantled parts of it. In his interviews, he still says the replacement plan is coming soon, and that's what the website says as well, but we still don't know what it is. There have been some executive orders related to drug pricing, and that's pretty much all I put together. So I think we have about 5 minutes for questions. Yes. Oh, so it was debated, and lots of versions of it were written, and there was a version that did include it. Yes. So I'm sorry, I need to repeat the question. My bad. The question was whether the Affordable Care Act originally included a public option. As I recall, Obama initially put forth a version that included a public option, but they weren't able to get enough votes for that version to pass. So the compromise was removing the public option, but keeping the individual mandate. And with no public option, that just basically means you're relying on private insurers to offer plans that meet these criteria and fit this regulation. And one challenge is that some plans only operate in some areas. So in some states or in some counties, there might not be a whole lot of choice. So that would be one benefit of the public option, would be at least making sure there's broad access to a certain plan. Yes. Mm-hmm. Sure. So the question was if I could comment on Bullock's response within Montana to the COVID outbreak and what how we did compared to other states. Yes. So I did. I gave some talks more related to that question last spring, and I do think there's evidence that Bullock acted swiftly, and that was effective. Because if you look at the numbers within each state, Bullock actually shut down schools and asked people to shut down schools, I think, even before there were any diagnosed cases, or right around, the first or second diagnosed cases. So it was acting much faster than, in some ways we had a late mover advantage because we had seen other states and seen how quickly it spread, so we knew to beware of that. But he used that late mover advantage effectively in shutting down swiftly. In terms of, and now, yes, we're in that second wave now. It's not nearly as bad as some of the other states, and part of the reason is also that we're a less densely populated state, so that also is a feature that works in our favor. I think he has been pretty effective in handling it. Especially if you compare to some of our neighboring states like South Dakota, North Dakota, Wyoming, Idaho. All of them have had worse outbreaks than in Montana, and more kind of resistance on the state level of how to act. So of course there's pushback. You never know there's always a cost and a benefit. So the controversy comes because there's economic costs when you're shutting down, but there's important gains in terms of minimizing the spread of this outbreak that'll allow the economy to function better over a longer period of time. Yes. The question was how pre-existing conditions such as obesity influence COVID death rates in the United States. That's a good question. There's been a lot of news about this recently because I think the CDC put out a report saying that 94% of the people who died of COVID-19 had a pre-existing condition, and some have been interpreting this to say, well, maybe they would have died anyways. The answer is, first of all, about 2/3 of adults have a pre-existing condition. So it's not like we're talking about the very sick groups. Pre-existing condition can be something like your cholesterol is a little elevated, you're obese, you're, all kinds of things are considered pre-existing conditions, and they do appear to correlate very strongly with the chance of dying from COVID, obesity especially, and other risk factors as well. So I would say, yes, they certainly make COVID more dangerous to you as an individual, but does that mean that it's not as bad as the death rate suggests? No, the death rates still, you saw from that graph, are way above where they would be in a normal year. So it's incorrect to say those people would have died of a condition anyways. That's not what the data shows us. Okay, yeah. Well, that's a good question. The question was whether Americans who are more conservative share my view of how Trump has mishandled the pandemic. So I think it depends on whether they are, or what, it depends on their knowledge and evidence they're looking at, or if they're just listening to what Trump says. Because if you listen to what Trump says, he's done great, right? And it's not his fault. So, and if, a lot of people still think, and maybe in Montana in particular, where we haven't seen a lot of deaths, so a lot of people are thinking we're being overcautious, we shouldn't be making such a big deal out of this virus that only kills a few people. So there's differing views on how important it is to try to tamp down the outbreak rather than letting it be out of control. And there's also, I did see one poll saying basically Democrats say in surveys that they care more about, that they're thinking more about the coronavirus outbreak when thinking about who to elect president. Republicans basically say that's not very important for them in thinking about who to elect president. So that's probably correlated with whether or not they think it's really as bad as I think it is. Yep. Does that answer your question? Okay. Thank you.